So this is gonna be a raw and unedited video. I'm gonna be honest with you all. Many students during this counseling, they are asking what is the difference between MD and DNB. There are many videos in the internet, but I will give you the brutal honest opinion because I have did my DNB general medicine and currently I am pursuing DRNB cardiology. So I think I'm quite an eligible candidate to speak to you all in this topic. So first thing is, most of the students are worried about the pass percentage. So I'll be honest with you, passing DNB is definitely a difficult task. Okay, so I'm not talking about the theory, at least for general medicine or common core clinical subjects, because the theory you need to study 10 to 15 years question papers and you need to go through the standard textbooks. Most of the theory questions you can answer because in DNB general medicine or general surgery usually you have 40 questions. Even if you answer 30 questions properly, you will pass. But there are some issues with orthopedics and pediatrics where the papers are also set very tough, like hard, very hard, where even passing theory is also difficult sometimes. But this thing is a gray area, theory, but practical definitely it is little bit tough because you go and write your practical exam at some other center in some other state. Suppose you are doing your general medicine DNB in Andhra Pradesh, your center might be in Bangalore or Kerala, Tamil Nadu. So you will go to some other state where there is a language barrier. Usually they give a translator, but still you are meeting the new examiner. But while in MD or MS, your HOD will be there, your professors will be there, your seniors or your juniors will be there, friends will be there. There will definitely be a little bit of help because practical is like all or none. Whether you do well or even if you don't do well, sometimes you can go through it. Okay, so definitely pass percentage is little bit less, but it's slowly improving, and maybe after 3 years it will be even more better. And another good thing about DNB, at least to increase this pass percentage, is we will have OSCE. So OSCE you will have for around 100 marks. So practical is around 300 marks, out of which 100 marks is OSCE. So 100 marks, if you can target around 70 to 80, so even if your examiner fails you out of 200, if they fail you and give you some 80 or 90 score, but if you score good in OSCE, suppose you got 80 out of 200 in core practical exam and you score around 70-75 in OSCE, so totally you will get around 155-160 out of 300, then definitely you will pass the practical also. So OSCE is a good thing for the DNB students. And second thing is, one very tough thing is thesis here. So DNB thesis is a very big headache. Okay, I'll be honest with you again. So many of my friends, seniors, juniors, they suffered a lot. I don't say ki everybody will have a issue with thesis, but definitely because the thesis you need to submit the protocol. Sometimes they raise their queries in the protocol also. And even after submitting your proper thesis, they raise the issues. So usually this time coincides with the time you are preparing for the theory exam. Okay, so you are seriously preparing for your theory exam, and then you get a query from the thesis like your sample size is not sufficient, or maybe you took a blood sample and you told it is an analytical study. Why did you take the sample? This is not intervention. Where is the consent form, or what language? All this unnecessary kind of drama we see in DNB thesis, definitely that causes extra stress. But whereas in MDMS, so thesis, yes, you will be given a guide, and it is more of a streamlined process, okay, in MD and MS. But DNB thesis little bit hectic, but you have to go through it. And third thing is hierarchy. Okay, so what happens is in medical colleges there are 3 years, like first year, second year and third year, and the hierarchy is maintained properly, where the first year works well. I mean, they work some extra hours, second year will take a little bit of less time, and whereas the senior, the third year, final year one will get more time to study. So that hierarchy is maintained. But whereas in DNB, in most of the places, you are treated like a duty doctor, so where you have to go and work fixed number of hours. You are responsible for the patients. because what happens in medical colleges, you can put your junior and you can tell them to, you know, take care of patients, you can go, you can study, or you know, so that kind of hierarchy is definitely maintained, and it's very helpful actually. So that is a sort of, you know, luxury in medical colleges, but it is often not seen in DNB institute. So that hierarchy is definitely, you know, you might feel bad when you see a contemporary MDMS friend enjoying and you have to go through all the stuff. And then toxicity. So toxicity is something which is there in every medical college or institute. Okay, it can be your senior, it can be your professor, assistant professor, HOD, or even the staff. Sometimes they may be toxic. Okay, so toxicity is not something which is limited to one place or the other. Many medical colleges, they are so toxic that even some students are, you know, I don't want to say that word, but you know, they are taking extreme steps. Okay, and even some DNB institutes also, there is toxicity, and we cannot confine that, say we can say that, you know, DNB is toxic or MDMS is toxic. Toxicity is everywhere, but even it is more in fact toxic in MDMS, where, you know, sometimes if the HOD or associate professor, assistant professors, they target you, you have to suffer the whole 3 years. Sometimes I hear the news where, you know, the HOD purposefully fails the students. You know, that kind of targeting mentality, toxicity is usually seen in medical colleges. So DNB institutes, most of the institutes, they are quite good. Okay, not much toxic. Definitely work stress will be there. You know, they will squeeze you, but you know, toxicity is a little bit less. And then public and society bias. So you know, people are afraid कि अगर मैं DNB किया बाहर आ गया, so people won't recognize me. So see, previously the issue was there, but now I don't think it is a big deal, because everywhere, any job they are offering, they're clearly mentioning MDMS or DNB, and even some institutes prefer DNB students. Okay, I mean DNB passed outs, because you know, I am not, you know, undermining or anything, but usually some DNB institutes, usually they are big corporate and private hospitals where there is availability of all the latest equipment. Okay, so when I talk to my contemporary MD friend, sometimes I say ki, every patient we check the serum sodium and potassium. We used to correct hyperkalemia and hypokalemia, and my friend is like, yeah, we never check potassium. So that is, see, that is a simple serum electrolyte, where in some prestigious medical colleges, also government medical colleges, they are not often done, but in, you know, we clearly see, and even many hi-fi tests. Okay, I just gave a small example, but very hi-fi tests. Suppose I am doing interventional cardiology, where the latest equipment like IVUS, OCT, or even big procedures like TAVR, all these things, you might not get what I'm saying, but all these equipment or all these procedures are usually not done in any government medical colleges. Okay, at least in the state in which I am doing my DRNB cardiology. And to be honest, and I'll tell one more thing. I joined DM cardiology, and because of some family reasons, I in third round of our counseling, I slid into the DRNB cardiology. Okay, so I got DM cardiology in my same state in a government medical college, but still I left that seat in next round and joined in a DRNB institute, which is near to my home, and I'm quite happy. In fact, I'm more happy because I'm getting more hands-on in the institute in which I'm doing, because thanks to my HOD, my boss, and all the teachers in our institute, where they are very gracious enough to give us proper hands-on. We are doing good amount of angiograms, PTCAs, and we are getting exposed to all the latest equipment, peripheral angioplasties, and all those things. I'm very grateful. Sometimes initially I was a little bit depressed that I left a DM seat for a DRNB, but you know, that's how it is in life. Sometimes you have to take bold steps. Okay, I don't know how this decision turns out in future, but it's a good thing. Okay, and another thing is even personal bias. Okay, so I have few of my friends who, while doing MD medicine, they joined MD medicine and I joined DNB medicine. And at that time they were like, yeah, DNB is not recognized, I won't join DNB. So some of my friends, they used to say those words like 3-4 years back, and those people joined in DRNB super specialty courses now along with me. So 3-4 of my friends, they have joined DRNB just because we are humans, okay? We evolve and we change our mindsets, okay? So previously we thought that it's under recognized, or passing is difficult, but everybody is joining, especially in the super specialty courses. My close friend, he wanted gastroenterology and he did not get DM, and he happily joined in a very good institute in Hyderabad, and he's doing well. He's just like me, doing second year DRNB gastroenterology, and some of my friends are also doing well, okay? So there is no personal bias or society bias, everything is going. But see, as I said, there are definitely hurdles in DNB. And another thing is, if you want to work as an assistant professor in medical colleges, definitely you need to do an extra SRship, especially if you are doing DNB from an institute which is less than 500 beds. You have to do 2 years of SRship, I think. So that rules, you can go through it everywhere, okay? Other than that, see, it's all about taking a bold step. And some of the students have been asking me, sir, I'm getting DNB medicine and MS general surgery from a medical college, government medical college, and DNB general medicine, which I have to opt. So for that students, I don't have any proper answer, because you are not able to make up your mind on a single branch. So you have to make up on a single branch, okay? So this is general surgery and this is general medicine, so completely different dynamics. And suppose if at all you don't want to put financial burden of taking a private medical college, you can gladly take DNB medicine or pediatrics. And then if you want to do super specialization, then you can try very hard for DM, cardiology, neurology, nephrology, or even pediatric neonatology, and anything you want to try, you can do. But instead of that's my personal opinion. Suppose if I am getting still a DNB institute now, I'll gladly take, and I'll think about doing DM after 3 years. And suppose if my mind changes, then also I'll be doing DRNB, okay? And another thing is, everybody know most of the DNB seats, they don't have any reservation. So some students, they cannot afford private medical colleges, the seats in private medical colleges. For them, DNB is like is a greatest gift, I mean to say, because you can get a super specialty or specialty degree at a meager price, and you'll even get a regular stipends. And if you are lucky enough, if you get a good institute, you can have good hands on, you can learn more than even your counterparts in MD/MS, okay? So I'm finally, my words are, it's not like MD is better or DNB is better. It all depends upon your institute and your mindset, okay? Make up your mind and have a proper decision. And another thing is, before joining any institute, or whether it's DNB or MD/MS, especially DNB, speak to the residents, speak to the institute. And one more thing is, see, sometimes when you speak to the residents are very much anxious. They already working residents, I mean to say. So they will say, institute is very good, come and join, because they are worried about their hectic duties and they want you to join so that the work is distributed. So along with residents, you go and see, okay? You can join in the first round, you see the institute, you see the workflow, you see what are the ups and downs, okay? Some students, what they do is, they get allotted a seat in the first round and they just sit at home and they don't join the institute, okay? What happens is, then you will not know about the institute. So what I advise every junior is, go to that institute and work. Or you just see the workflow for 1 week or 2 weeks, and then you will get to know about that institute. So then you can put an upgrade, okay? If you get an upgrade, that is well and good. Suppose if you like the institute, you can continue in that institute, okay? So go and stay there at least for 1 week, because see, selecting a specialty branch is like for life. It is like selecting a spouse, as many doctors say. So you work there, okay? You see if there is any toxicity, any ups and downs, okay? I think this video is long enough. If it is helpful, you can like it, share it with all your friends. And also, if you have any queries, try to comment. I'll try my best to answer them. Have a nice day. All the best.